several relevant issues that are the answer to number 2. 1, physicians have an obligation to heal. Moses Maimonides, the greatest of the medieval scholars and arguably one of the greatest physicians in the world of his time, concluded in his commentary on the Talmud, it is obligatory from the Torah for the physician to heal, and this is included in the explanation of the phrase from the Bible, and you shall restore it to him, meaning to heal the body. Second, patients have an obligation to obtain health care, that they have both an obligation to obtain health care and a concomitant right to be able to obtain it. Our bodies and souls belong to God, and we have to ensure that they are cared for. The verse in Deuteronomy 4:15, and you shall indeed guard your souls, is a traditional source for the requirement that we protect our health. Furthermore, based in the passage in the Talmud, whoever is in pain, lead him to the physician, the rabbis concluded that Jews have a right to health care and should live only in cities where health care is available. Third, the same verse is used to require preventive medicine. The Talmud concludes that this verse mandates that each person must act to preserve his or her physical health. So Maimonides understands this obligation to include both positive commandments, such as regular exercise, and negative commandments, such as refraining from damaging one's body through the consumption of dangerous foods or drugs, a view on which some modern Jewish halakhic scholars, legal scholars, rest their assertion that smoking would be prohibited by the Jewish tradition. And this concern for preventive medicine placed obligations on the community as well as on the individual. In the late Middle Ages, physicians hired by the communities in several areas of the Jewish world would go household to household in a community, providing recommendations for the health and well-being of each person. Fourth, providing health care generally was not just an obligation for the patient and for the doctor, but for the society. It is for this reason that when the Rambam Maimonides lists the important communal services that every moral city had to offer its inhabitants, health care is number 1. Both access to a physician and separately listed, number 2, a surgeon. These are the first 2 requirements that are listed in the Rambam's obligation of what a city must provide. And during long history of the self-governing Jewish community, most Jewish communities set up societies to ensure that all their citizens would have access to health care. You have to remember, the self-governing Jewish society, in the way it collected charity and administered it, it was a taxation system. That was the governing body. It is the equivalent to our public sector today, not the private charities today. And where necessary, doctors could be required to reduce their rates for poor patients. And where that was not sufficient, communal subsidies would be established. A. Newman, in his authoritative book on the Jews in Spain, this is from talking about Jews in the 14th and 13th centuries, the physician, on assuming the duties of his office, to which he was appointed for a term of years, made a medical examination of every person in the territory under his jurisdiction, and then gave everyone advice according to his findings in the light of the knowledge of science of medicine and as God inspired him. These were mutually reinforcing ideas. He treated the poor in the public hospital. He was obliged to visit every sick person at least 3 times a month. Fifth, quality health care was ensured by communal government regulation. Doctors were able to set their own fees. But if members of the community were not being served because of extravagant fees, the communal authorities would regulate the fees. Doctors were given substantial protection from malpractice suits, but they were licensed and regulated by the communal authorities. And in certain communities, consumer protection was ensured by allowing victims of medical negligence to sue not the doctor, but the community that licensed him if they were on notice of prior malpractice or medical negligence. 6, cost containment was ensured. This was achieved in part by requiring doctors could not charge fees so high that the patients couldn't afford them, that I just alluded to. But there was an even broader regulation regarding the cost of medicine under one of the most important consumer protection provisions of the entire Jewish legal tradition, a concept called ona'ah, which originally asserted that any sale of goods must be within 1/6 of the actual fair market value. Needless to say, it was such a weight on a vibrant economy, it quickly got constricted during the Talmudic era, but it always applied, even until today, to things that are essential to life, such as food and healthcare, essentials of food and healthcare, so that medicine. So, for example, if an epidemic, somebody jacked up provider of medicine to an outrageously high price, you pay that price, but as soon as the epidemic goes over, you could go to court and get the money rescinded that over and above what the actual cost plus 1/6 to the person would be. So you see a wide variety of rules and regulations from the Jewish tradition that set moral standards that said people have a right to health care, people had an obligation to take care of themselves and to get health care. Doctors had to be sure that people were treated. Beyond that, they had a lot of freedom to do as they wanted in their judgment, that poor people were protected by this system through government hospitals and government regulation and government subsidies for the community. That speaks across the centuries to many of the core issues that are at debate today. The one other one that I would just flag is the whole issue of triage. It is endemic in any important healthcare debate.